Hey, this is Rick Kasalj, injury specialist from exercisesforinjuries.com. In today's video, I wanted to answer a question that I ended up getting in the Exercises for Injuries secret face group. And what it was, what can I do about shoulder pain with prisoner squats? So prisoner squats are something that I oftentimes end up recommending for knee, hip, shoulder, and back pain. So it's an exercise I oftentimes recommend. And if you don't know what it is, I'll get Andrea to demonstrate and I'll kind of talk about it. So with your foot position, flat feet, you're looking at hip to shoulder width apart. With the hands, they're interlaced in behind the head. You're going to bring the elbows back. You're tightening up the mid-back muscles, but you're not shrugging up. And then you're going through a squatting movement, bending in the knees, bending in the hips. When you bend in the hips, I want the rest of the body in nice, good alignment. And ideally, I like the hips to just pass the knees. And the reason why the hips past the knees really can bring in the hamstrings and the glutes in order to get out of that bottom position. So if I just go down, one more, just above, if I go above and back up, it tends to be a lot more quads and puts a lot of stress on the knees. If I go a little bit further, I can get help from the glutes and the hamstrings in order to get out of that position. Now, a lot of times people will say, "I'll just get you to face the back wall and just get that hand there." A lot of people will tell me, "Hey, Rick, getting in this position is too difficult for me. I have shoulder pain, or I just don't have the shoulder flexibility. What are other things that I can end up doing?" Now, what you can end up doing, there's three options. I can go arms crossed, and I'll get Andrea to demonstrate all of them. So I can go arms crossed, and then I can go through that squatting movement. Everything else ends up being the same. So that ends up putting the shoulder in a safe position. The negative of it ends up being I'm not really getting that I'm not really working on the flexibility in the shoulder, stretching out the shoulder, or working on that mid-back strengthening, which is what I want. But if your shoulder is really sensitive, then I can, and injured and painful, then you can start off with that arms crossed bodyweight squat. Now the next option ends up being arms at the side at 45. So Andrea's got the arms at the side at 45, then she's going to go through that squatting movement, good, and coming back up, good. So the rest of the squatting movement ends up being fine and normal, good, and coming back up. Now I'm just going to get you to face the back wall, and I'm just going to show, so she's here, I'm just going to take the hair out of the way, and then you want to try to remember you're tight through here, so tight through here and got a good alignment to the side, and then you're going through that squatting movement. So we're working on the mid-back muscles, mid-trapezius, all those scapular muscles, and then we're going through that movement and we're working on good alignment. And with the arm being in this position, it's a safe position. And with the arm being about 45 degrees away from the body, then we start working rotator cuff. We start getting the rotator cuff involved, and also really bringing those shoulders back and tight through here. If you're really tight in that front part of the shoulder, you'll get a light stretch, which is what we want. Now, the third option ends up being at 90. So the arms are at 90. So arms are out to the side, good. And then going through that squatting movement, good. Good. And then from the front, good. Good. And then I'll get Andrea to face the, so same thing ends up applying. So she ends up being, tight through here, brings the arms back a little bit, getting a little bit of a stretch in the front of the chest, and then looking at activating and tightening up that mid-back area. Now, one more other option ends up being we can go arms overhead is an option that you can end up doing as well. So Andrea is going to bring the arms straight overhead, good, and then going through that squatting movement, good. So this would be for someone, if you'd have poor mobility and flexibility in order to get this position, this ends up, the arms straight overhead, I'll get you a couple repetitions. Arms overhead ends up being a good option if you don't have the flexibility. So this one, good. So everything else ends up being the same. Arms overhead, going through that squatting movement, and then I'll get you to face this way, and we'll do a couple repetitions that way. So this ends up being the fourth level that you can end up doing. Good, one more repetition. Good. And then I'll just get you to face that way. So with the arms straight up overhead, she's doing the same thing. Tight through here, and now with the arm overhead, we're really working a lot more on those scapular muscles, especially the lower trapezius, and really working and targeting those muscles. Because when the arm ends up, rotate it down, when the arm gets above 90, then we start getting a lot more work being put on the shoulder blade muscles, and especially at that position. She's not straight at 90, a little bit to the side. That really ends up working that lower trapezius. So there you go, that ends up answering that question. What to do about shoulder pain with the prisoner squat. So you have the 4 different options: arms crossed, arms at 45, arms at 90, or arms overhead. So you can pick any 4 of those to do, and as I said, they end up being progressive in nature. So this is Rick Caselj. Now, if you end up having shoulder pain and are looking for some other tips and tricks that I end up having with shoulder pain, what I recommend for you to do is click right here. I have a brand new report called 5 Tricks That Fight Shoulder Pain and Tightness. Just click right here, let me know where to send the free report, and I'll send the free report right away. Now, if you're watching this video on a mobile device or a tablet, head down below in the description, click the link, let me know where to send the free report, and I'll send you that free report right away. Now, if you got benefit from this video, make sure to like this video. If you have a question or comment for me, leave it down below in the comment section. And lastly, make sure to hit subscribe in order to get future pain relieving videos.